Good morning. Short review about shock. Shock is a critical condition on by the sudden drop in blood flow through the body. Shock may result from trauma, heat stroke, blood loss, an allergic reaction, severe infection, poisoning, severe burns, or other causes. When a person is in shock, his or her organs are not getting enough blood or oxygen, and shock is an incredible condition. In this case, decreased tissue perfusion leads to organ failure. In shock, BP will be severely low, so oxygen deprivation in tissues, and there are 4 stages in shock. In initial stage, anaerobic metabolism happens, that is metabolism without oxygen. In this stage, no signs and symptoms you can find. In compensatory state, the second one, there will be tachycardia, increased heart rate, and increased respiratory rate, tachypnea, and the vital signs will be speed up in this stage. And third one is progressive stage, cold clammy skin, that is the early sign, and that means body lacking of perfusion. Fourth one is irreversible stage, that death will happen. There are 5 types in shock: septic shock, hypovolemic shock, cardiogenic shock, neurogenic shock, and anaphylactic shock. In septic shock, it happens due to sepsis, that is infection, maybe due to bacteria, urinary tract infection, UTI, and pneumonia. Signs and symptoms in septic shock: low blood pressure, organ failure, cold clammy skin, patient will be in confused state, disoriented, high WBC, increased temperature initially and then it will drop, and decreased urine output. The treatment will be IV fluids and antibiotics. The second one is neurogenic shock. In neurogenic shock, due to spinal cord injury in T6 or higher than that. In neurogenic shock, there will be blockage of sympathetic nervous system. So vasodilation occurs. It leads to decreased cardiac output. It causes poor tissue perfusion, leads to organ failure. And signs and symptoms will be bradycardia, low heart rate, low BP, skin will be warm, pink and dry. Treatment will be IV saline, 0.9% normal saline to increase BP. Complications in neurogenic shock, that is autonomic dysreflexia. AUT autonomic, NOMIC autonomic dysreflexia, DYSREFLEXIA dysreflexia. So we have to loosen the tight rows around the hip, and IFC inserted indwelling Foley's catheter to keep the bladder empty. Next one is hypovolemic shock. Hypovolemic shock due to trauma, burns, gunshot injury. It leads to blood loss and diarrhea, vomiting, fluid loss by burns, GI bleeding and trauma. Signs and symptoms will be cold, clammy skin, hypotension, tachycardia, low CVP, central venous pressure. It will be 2 to 6 centimeter of water normally. It will be low, and low urine output, that is less than 30 ml per hour. Treatment: IV normal saline, hemodynamic stability. To keep hemodynamic stability, IV normal saline to be given, and lower the head bend. Put the head low when there is hypovolemia. And vasopressors administered, that is norepinephrine and dopamine to increase blood flow, and mean arterial pressure will be 65 millimeter of mercury, and to keep CVP 2 to 6 centimeter of water. CVP is central venous pressure. And next one is cardiogenic shock. It is due to heart failure, myocardial infarction. In weak heart muscles, cardiogenic shock happens. Signs and symptoms: drop in blood pressure. Treatment: dopamine, digoxin. It helps the heart to pump forcibly. Next one is anaphylactic shock. That is due to severe allergic reaction, eating seafood, or peanut allergy, or bee sting. Medicine may be allergic to some people, or food may be allergic to some people. Due to that, anaphylactic shock happens. First drug is epinephrine. It should be given IM in the thigh and hold for 10 seconds. Second drug is diphenhydramine. Diphenhydramine, DIPHENHYDRAMINE. Diphenhydramine. The third drug will be albuterol steroids. Signs and symptoms: hives, or otherwise called urticaria. Common people, we can tell allergy reaction. Swelling, flat swelling, or large flat map like swellings, hands, in the legs and abdomen, everywhere. Next one is dyspnea, difficulty in breathing, hypotension, low BP. And side effects of epinephrine: there will be tachycardia and palpitation. This epinephrine, they are calling this EpiPen. It should be given IM in the thigh and keep hold for 10 seconds. And take the patient to hospital, rush to hospital. And this EpiPen should be stored in cold, dark place, in room temperature, not in the refrigerator or not in the car. Thank you.